Hi everyone, welcome to Professor Orthodontics, your online classroom to understanding orthodontics in simpler terms. Today we learn about orthodontic implants. This session will be an introductory lecture on orthodontic implants. We'll focus more on how orthodontic implants are different from prosthodontic implants and how are they similar to at the same time. So let's get started. I have prepared three parts in the introductory section of orthodontic implants. Basically, the introduction will be covered over three different presentations or three different videos. The reason being, orthodontic implant is in itself a very vast topic, and I feel the introduction on its own needs three different presentations, and if required, few more presentations can be added at a later time. So, what are orthodontic implants and why are they used and when are they used? This we learn today. In this picture, we can see in the lower left corner there is a range of screws, mini screws. These are type of orthodontic implants, the screw type of orthodontic implants. They are also called as mini screws orthodontic implants. Now, why are they called mini screws? Because they are very small in size. They are also called as micro implants, and you can see that there is a gradation. There are different lengths. These mini screws are available in different lengths and different diameters. The head of the mini screw has a small opening or a hole to place ligature wire so that you can attach the tooth which needs anchorage to the implant and help this will help in giving um, indirect anchorage to the implant. With the help of implant you can achieve indirect anchorage. There are two type of anchorages that you can obtain from orthodontic implants. It's called direct anchorage and indirect anchorage. So in direct anchorage, what happens is the teeth that are to be moved are directly hooked to orthodontic implants at one end. In the sense, you want to retract maxillary anteriors, and all the maxillary anteriors are consolidated, and the E chain is attached bilaterally from bilateral canine distally, and it's attached to the orthodontic implant, which is placed in the buccal attached gingiva of the first permanent molar, and similarly on the other side. By doing this, the teeth that are to be moved are directly attached to the orthodontic implant, hence the anchorage that is derived here is a direct anchorage. Whereas when the teeth that are to be moved are attached to another anchorage unit or an anchorage tooth, for example, instead of attaching the E chain, distal end of the E chain bilaterally is attached to the first permanent molar hook. The hook present on the band of the first permanent molar bilaterally, and that molar is attached to this orthodontic implant with the help of a wire or a TPA. That's an example of an indirect anchorage which is achieved from an orthodontic implant. So orthodontic implant can be used for both direct and indirect anchorage. In this picture, we can appreciate how small is orthodontic micro screw. You can see that it's very small. It's as big as long as the nail of this person. And again, the screws need not be this big. It can be smaller and it can be more thinner and more slender than this. So when do you use orthodontic implants? There are many indications, but we speak of the four common indications. First and foremost indication will be wherein you have a high anchorage requirement. Cases with high anchorage value requirement, in such cases orthodontic implants are used. Now, what do you mean by high anchorage case? We have discussed that in our earlier session, which was on anchorage and different types of anchorage. You can just go through that video if you would like to know more about that. So cases which need high anchorage value, that in such cases we advise orthodontic implants. Another indication would be cases wherein you do not have adequate number of anchorage teeth present. Say the patient is partially edentulous and the molars are absent, or you have few molars present on one side and they are absent on the other side, or bilaterally. Especially in adult orthodontics, orthodontic implants are extremely helpful because they help in giving you anchorage wherein there are none. Okay, then the third example would be you have anchorage teeth, but then the case is such that that is not enough. In the sense, you want to bring about retraction of bimaxillary protrusion cases there, and you want to retract maxillary and mandibular anteriors, and it's a kind of a case that you cannot afford to lose any anchorage, and in that case you know that even after reinforcing anchorage with a TPA or a Nance palatal button, some amount of anchorage loss will be there. In such case, orthodontic implant can be used to reinforce or enhance the anchorage. Another example would be cases wherein obtaining true tooth movement is difficult. In traditional orthodontics, achieving true intrusion is very difficult. And usually what happens is, if you are achieving 2 millimeter of intrusion, maybe 1 millimeter of that intrusion will be relative, in the sense the tooth has not actually intruded, but in fact flared. One usual tooth that is subjected to intrusion often orthodontically during treatment is maxillary and mandibular anteriors. Usually mandibular anteriors, when they show some amount of intrusion, maybe you're correcting the bite, or maybe there is some other reason, but in such cases what happens is true intrusion is not obtained. Say you're achieving 2 millimeter of intrusion, it need not completely be because of intrusion. Maybe half of it or maybe more than that is appearing to be intrusion, but actually is due to flaring of the teeth that the tooth appears to be intruded. So such tooth movements which are difficult to achieve, for example true intrusion, they can be achieved more satisfactorily, and there is scientific evidence that with the help of micro implants and orthodontic implants, any type of orthodontic implant, achieving mandibular anterior and maxillary anterior and even posterior intrusion, true intrusion, is possible. So the fourth indication being cases that may need surgery. So there are cases wherein the patients are usually advised surgery, but of course the patients are apprehensive to undergo surgery. So in such cases, orthodontic implants can be used to bring about some amount of change which otherwise would not have been possible just with regular orthodontic treatment. So cases which have a slight class 3 tendency and may be advised orthognathic surgery can be managed with the help of orthodontic implants to give satisfactory result. Maybe not up to the mark, but then still, if the patient is not happy with undergoing surgery, and if the result that can be obtained just with the use of orthodontic treatment and orthodontic implant is decent enough for the patient, if the patient feels happy enough, if he's satisfied with the treatment, then we can opt for a combination of orthodontic treatment with micro implants. Another example wherein orthodontic surgeries are often advised are vertical maxillary excess, in which the patient has extremely gummy spine. So in such cases wherein the patient is actually advised ideally to undergo orthognathic surgery, combination of orthognathic surgery and orthodontic treatment, some patients are apprehensive about it and may not want to undergo it. In such cases, yes, the 90% results can be obtained with orthodontic surgery approach. But if the patient is happy enough with, if the patient thinks that I would do anything to avoid surgery, in that case the patient can actually benefit from using a combination of orthodontic treatment and implants, because you can bring about more amount of intrusion and decrease the gumminess of the upper anteriors with the help of orthodontic implants and orthodontic treatment combination. So now, how are orthodontic implant different from prosthodontic implant? In this picture we can see that a premolar has been replaced with the help of a prosthodontic implant. Coming to the differences, well, there are n number of differences between prosthodontic and orthodontic implant. First of all, the first point is how long are these in use? The prosthodontic implant are supposed to serve the purpose of replacing missing teeth, one or more than one teeth, with the help of prosthodontic implant. So obviously the implant is supposed to last, or it does last for at least a couple of years, maybe 10 years, or sometimes even more than that. Whereas when it comes to orthodontic implant, we know that orthodontic treatment to a maximum may last as long as 2 years, not more than that. And then again, the orthodontic implant can be in place only during that period during which the anchorage loss is high, or the presence of orthodontic implant is required. Say it is a case wherein maxillary anteriors are to be retracted only up to the point where the anteriors are retracted and the desired maxillary incisor inclination is achieved, we can keep the orthodontic implants in place and use them. Once the purpose is complete, we can as well remove the orthodontic implant, and the implant need not be in place in the oral tissues till the finishing and detailing stage of the treatment. It need not be, you can remove it much before that. The second point being osseous integration. We know that bio-osseous integration, the the healing tissue that forms between the implant surface of prosthodontic implant and the biologic tissues forms the main key factor for the success of prosthodontic implants. Whereas in case of orthodontic implants, it need not always happen, and whether even if it doesn't happen, it's okay. The orthodontic implant can still succeed. Why? Because in the coming session we'll be learning about it. But just to brief you, orthodontic implants they rely for success mainly on primary stability. In the sense, they do not rely on osseous integration. The success of orthodontic implant does not depend on the bio-osseous integration between the implant and the biologic tissues. In fact, it mainly relies on mechanical interlocking between the implant surface and the biologic tissue. Yes, osseous integration does enhance the anchorage of orthodontic implant and increases the success of orthodontic implant, but it need not always be present. You need not always achieve osseous integration for the success of orthodontic implant. What is the purpose of using a prosthodontic implant? Well, the purpose is very clear: replacement of a missing teeth or a missing tooth or missing more than one tooth is the indication for the use of prosthodontic implant. Whereas the goal of orthodontic implant is to provide absolute anchorage during orthodontic treatment in cases of high anchorage value, or in cases wherein the anchorage is next to absent. For example, patients with multiple posterior teeth missing, patients partially dentulous. In such cases, that's the goal of orthodontic implants, to provide anchorage. Now, coming to the fourth point, can we use orthodontic implants instead of prosthodontic implants? No, you cannot use orthodontic implants as prosthodontic implants. It's obviously not possible. But can you use prosthodontic implants as orthodontic implants? Well, yes, you can use prosthodontic implants as orthodontic implants. In the sense, say a patient is already having a prosthodontic implant in his mouth and you want to start an orthodontic treatment for that patient. In that case, you can use the prosthodontic implant, which is already there in place, to increase the anchorage value of the teeth. In the sense, say you want to retract the maxillary anteriors and maxillary first permanent molar is missing in this patient. So that patient is having a implant in the maxillary first permanent molar place. In such a patient, we can indirectly attach the wire, arch wire, to the tooth which is having an implant, to the prosthesis, and with the help of that, we can increase the anchorage value of the posterior unit, and hence this prosthodontic implant can also act as an orthodontic implant in during the treatment. So that's how the prosthodontic implant can play the role of an orthodontic implant at the same time. You need not add another orthodontic implant, at least on that side of the arch during the treatment. Fifth point, resting period. During prosthodontic implant, there's something called as loading period, in the sense that you cannot, after you place a prosthodontic implant, you cannot immediately place a crown on it, and the patient cannot immediately use that implant for the purpose of mastication or for function. Whereas in case of an orthodontic implant, you can. In the sense, during prosthodontic implant treatment, patient has to undergo 3 or 4 or 5 months of loading period. The patient has to wait for the implant to heal and bio-osseo integrate with the biologic tissue, and then the implant is put to use or function. Whereas in case of orthodontic implant, the implant can be loaded immediately the same day or in the next few days, so as to use them for its full purpose. You need not wait, there is no waiting period. The sixth point, yes, the prosthetic implants are quite large. You've seen in the earlier picture that they are larger in diameter, longer in size, they are more bulkier. Of course, they are bulkier because they have the artificial roots and they have to replace natural root. So they have to be a replica or a copy of the natural teeth, and hence they are bulky. They are like a root, they are bulky. Whereas the orthodontic implants are more finer, they are more they are more delicate. They are, for example, if you compare orthodontic implant with a orthodontic sorry the prosthodontic implant with an orthodontic implant screw type, then you'll see that the orthodontic implants are smaller in diameter, they are shorter, and they are narrower in size, whereas the prosthodontic ones are more bulky. Now, the seventh point being, before you place a prosthodontic implant, you have to do a pre-drilling procedure. At least as of now, till today, that's the trend. In future, this may change. But yes, during prosthodontic implant, you have to do a pre-drilling procedure. So before placing the implant, there has to be a drilling procedure that has to be done. Space has to be created into the bone, and then the implant is placed. Whereas in case of an orthodontic implant, that's not the case. There are implants, yes, which do need pre-drilling, but then it is not a major procedure. And then there are implants which are available which do not need pre-drilling, so there are non-drilling requiring implants also that's present during in orthodontic implants. Coming to the ninth point and the 10th point, well, the procedure of placing a prosthodontic implant is a little longer than that of an orthodontic implant. So the procedure that is done for placing a prosthodontic implant, that is more invasive. So obviously the patient will have post-operative discomfort, some amount of pain may be there. But in case of an orthodontic implant, it is a non-invasive procedure. It takes less amount of time to complete the procedure, and the patient does not have pain or any discomfort after placing the implant. And like I said, you can load the implant or you can use the implant for orthodontic treatment immediately as soon as you place them, or you can wait a day or two, but then the procedure can be done in about 15 minutes maximum. Coming to the kind of force that is exerted on the implant, point number 8. So in prosthodontic implants, because the main purpose of the So, coming to point number 8, the main purpose of using a prosthodontic implant is replacement of missing tooth or multiple teeth. So, obviously, the main purpose is being able to take up the occlusal load of mastication. So, we have to make sure that the long axis of the implant is such that the force of mastication is along the long axis of the teeth, or else the implant can fail. So, angulation of the implant is very important that way. But in case of an orthodontic implant, the force always need not be along the long axis of the implant. In the sense, it can be in any direction. So the axial placement of the implant is not always along the long axis of the orthodontic force. It can be in any direction. So direction of the orthodontic tooth movement will decide the angulation of force that will be exerted on the orthodontic implant. And coming to the final point, how orthodontic implants are different. Well, the location of orthodontic implant can be anywhere as per the requirement of the Anchorage unit. So the location of the orthodontic implant is decided by where you want your Anchorage unit to be. If you are retracting the maxillary anteriors, you would want them distally and posteriorly on the buccal side and on the palatal side, or only on the buccal side or only on the palatal side, depending on the requirement of the patient case. Similarly, if you want to intrude the mandibular anterior, the placement of these Anchorage implants will be apical to the root of the mandibular anteriors on the attached gingiva, firm attached gingiva area. Whereas in case of an prosthodontic implant, the placement is always on the ridge, because you want to replace teeth, and teeth are always on the ridge. So the location varies for both of them. Of course, orthodontic implant can also be placed on the ridge, but that happens very rarely. So coming to the similarity between the orthodontic and prosthodontic implants, there are a few similarities. Of course, both of them are biologically inert. Both of them are available in titanium and vitalium. But then, yeah, the surface of some of the prosthodontic orthodontic implants have also been treated with bioactive materials so as to facilitate uh, osseointegration between the implant and the in a biological tissue. So some of the implants, orthodontic implants, are treated such that surface treated so as to increase osseous integration. But then the disadvantage is that during removal, the procedure becomes a little invasive, because the tissue has bio-integrated with the orthodontic implant. So it becomes a little invasive procedure when osseous integration to that extent happens. That's it, guys. That's it for today. And in the coming session, we'll be learning about the different types of orthodontic implants, different designs. Are orthodontic implants only available in screw form? No, there are many different designs and types available, and we'll be learning more about them. Thank you for staying till the end. If you like this session, please like, share, and subscribe. And if you found any corrections or any mistakes or any things that I can improve in my sessions, please drop them in the comment section below. Thank you.